Prostate cancer is one of the biggest health threats men face, affecting 1 in 8 men in their lifetime. In 2024, over 300,000 new cases are expected in the U.S., with more than 30,000 lives at risk. But there's hope. Early detection and treatment can dramatically improve survival rates. Most men never think about their prostate until symptoms appear, but catching the warning signs early could mean the difference between life and death. Stay tuned as we reveal the most important symptoms you should never ignore and how you can protect yourself against this deadly disease. Before we dive in, if you enjoy tips on staying healthy, active, and full of energy at any age, don't forget to hit that subscribe button and turn on the notification bell. That way you won't miss any of our weekly videos designed to help you live your best life, no matter your age. Let's get started. One of the earliest and most important warning signs of prostate cancer is experiencing pain or a burning sensation during urination. This discomfort often signals that something is disrupting the normal flow of urine, and as a prostate tumor grows, it may press against or invade nearby structures, making urination increasingly uncomfortable. Sometimes these symptoms can also occur alongside urinary tract infections. While antibiotics might temporarily ease the pain if an infection is present, persistent or recurring discomfort should not be ignored. It's crucial to seek a thorough medical evaluation, as these symptoms could be linked to something more serious like prostate cancer, especially if relief is only temporary or incomplete. Certain factors can put you at greater risk, including a family history of prostate cancer, being overweight, or having unhealthy lifestyle habits such as poor diet and lack of exercise. By paying close attention to your body and acting on early symptoms like urinary pain, you give yourself the best chance for early detection and successful treatment. Remember, prompt medical attention can make a significant difference in outcomes. If you notice any unusual urinary discomfort, even if it feels minor, don't hesitate to discuss it with your doctor. Taking quick action not only helps identify or rule out infections, but can also catch potential problems like prostate cancer much earlier, leading to better, more effective treatment options. Stay proactive about your health, keep up with regular checkups, and know that caring for yourself today means giving yourself a brighter, healthier tomorrow. Waking up often during the night to urinate, a condition known as nocturia, can be more than just an inconvenience. It's an important warning sign you shouldn't ignore. Many men find themselves getting up several times each night to use the bathroom. And while this may seem like a normal part of aging, it can actually signal underlying health problems, including the possibility of prostate cancer. Regularly disrupted sleep can take a toll on both your body and mind, leaving you feeling tired, less energetic, and even affecting your mood. If this issue is happening to you frequently, don't simply chalk it up to growing older. Instead, consider it your body's way of letting you know that something deeper might be amiss. It's essential to discuss this symptom openly with your doctor so they can help identify the cause and provide the right treatment. One helpful step is to keep a nighttime urination log. By noting how often you wake up and any other changes you've noticed, you'll offer your healthcare provider valuable information that can lead to a quicker, more accurate diagnosis. Remember, early detection of prostate problems can make all the difference in successful treatment. Don't hesitate to get the support you need. Caring for yourself in these small but important ways can help you maintain your quality of life, protect your health, and give you peace of mind. Taking action now puts you in control and ensures you don't miss an opportunity to address problems while they're still manageable. Stay proactive and remember that your well-being is worth it. Noticing blood in your urine, a condition called hematuria, is a symptom that should never be taken lightly, especially for older adults. While it isn't the most common sign of prostate cancer, its appearance can indicate the disease has reached a more advanced stage, requiring prompt attention. Blood in the urine may be so slight that it's only detectable through laboratory tests, a form known as microscopic hematuria, or it may be clearly visible, turning urine pink or red, which is called gross hematuria. This symptom occurs when tumors spread from the prostate into the urinary system, like the bladder or kidneys, causing blood to leak into the urine. It's important to understand that only a small percentage of individuals with prostate cancer experience hematuria, but when it does occur, it's a significant warning sign. Recognizing this symptom underscores the critical importance of regular urine tests and routine medical checkups, especially as we age. These tests can detect even the smallest trace of blood long before it becomes visible, increasing the chance of early intervention and more effective treatment. Remember, early detection offers the best path toward beating prostate cancer and maintaining your quality of life. By staying vigilant for unusual symptoms and prioritizing your regular health screenings, you give yourself the greatest chance of catching potential problems early. If you or a loved one ever notice blood in your urine, no matter how minor it appears, don't hesitate to reach out to your healthcare provider. Taking action early can make all the difference. You're not alone on this journey. By staying proactive and informed, you're investing in your health and your future. Persistent pain in your back, hips, or legs, especially when there's no clear reason, should never be brushed aside, particularly for men. Such discomfort could be an important signal that prostate cancer has spread beyond the prostate gland to the bones, a condition known as metastasis. This type of pain often becomes chronic and does not improve with typical remedies. If you notice that this pain lingers or worsens over time, it's a sign your body needs attention. Additionally, when cancer affects the bones, it can compress nearby nerves, which might cause weakness, numbness, or tingling in your limbs. These symptoms might seem easy to overlook or attribute to age-related issues, arthritis, or everyday strain. However, in the context of prostate cancer, they become much more significant. Ignoring such warning signs can delay diagnosis and treatment, potentially reducing your options for effective care. The sooner you bring up these symptoms with your healthcare provider, the better your chance for timely evaluation and intervention. Early assessment makes a crucial difference, offering the possibility of more successful treatments and preserving your quality of life. Remember, proactive care and open communication with your doctor play vital roles in your long-term health. If you're experiencing persistent, unexplained pain or weakness in your back, hips, or legs, don't try to tough it out. Seek medical advice promptly. Your vigilance and willingness to act can profoundly influence the outcome, helping you stay active and engaged in the years ahead. Prioritize your well-being and always listen to what your body is telling you. Sudden, unexplained weight loss is a symptom that deserves your full attention, especially as you enter your 60s and beyond. If you notice the pounds dropping off without any changes to your eating or activity habits, it's important not to brush this off as a harmless change. When prostate cancer develops, the cancer cells can actually consume a large amount of your body's energy, leading to a disruption in your metabolism. This process can cause persistent fatigue, a loss of appetite, and sometimes even nausea, making it even harder for your body to maintain a healthy weight. While some people might feel pleased about easy weight loss at first, remember that losing weight without trying is rarely a blessing, particularly later in life. It is often a sign that your body is fighting something serious beneath the surface. Unintentional weight loss can be linked to several underlying health conditions, including a number of cancers. That's why it's critical to reach out to your healthcare provider as soon as you notice this happening. Swift medical attention means that your doctor can identify the underlying cause, prostate cancer or otherwise, and help you get the treatment and support you need. Remember, early detection truly makes a difference when it comes to successful treatment, and your vigilance could be life-saving. Don't wait and don't second-guess your instincts. Taking action is always the right choice when it comes to changes in your health. By staying aware of symptoms like unexplained weight loss and seeking medical advice promptly, you are empowering yourself and taking important steps toward maintaining your well-being. Pain or discomfort in the rectal area can be an important warning sign if prostate cancer spreads locally. When the cancer grows beyond the prostate, it may press against or invade the rectum, causing a range of uncomfortable symptoms. You might experience pain, constipation, diarrhea, incontinence, a feeling of bloating, or in more serious cases, a partial blockage of your bowels. These symptoms can easily be mistaken for less serious conditions, but it's essential not to overlook any changes in your bowel habits. Early recognition truly matters. Getting evaluated quickly can make a significant difference in your health outcomes. Diagnostic tests such as a digital rectal exam, ultrasound, or PSA blood tests are effective tools that doctors use to determine the cause of these symptoms. Medical advances mean that if prostate cancer is caught early, treatment is often much more successful, improving both quality of life and survival rates. If you notice new or persistent pain in the rectal area, problems with bowel movements, or any unusual changes, don't hesitate to speak to your doctor. It's natural to feel uneasy about these kinds of health issues, but remember, taking action as soon as you spot warning signs is a smart step toward protecting your well-being. Regular screenings and timely evaluations are especially important for older adults, as they help detect issues early, often before symptoms become severe. Staying proactive with your health empowers you and offers the best hope for a positive outcome. So listen to your body, report any concerns promptly, and encourage those around you to do the same. Your vigilance could truly save your life. Experiencing pain or discomfort while sitting, especially in your pelvic area or lower back, is something you should take seriously. For men, these symptoms can be linked to an enlarged prostate, which may be caused by prostate cancer. This type of pain may feel worse when you're sitting on hard surfaces and can sometimes be accompanied by numbness. It might seem like a minor or occasional issue, but it's important not to overlook it, as it could be an early warning sign that something more serious is happening with your health. Pain in these areas may signal that the disease is progressing or affecting nearby tissues. If you notice this type of discomfort, it's crucial to prioritize your well-being by scheduling a full medical examination. Early detection is the key to effective treatment and better outcomes, so reaching out to your healthcare provider promptly can make all the difference. Remember, discomfort isn't something you should simply live with, especially as you get older. Awareness and action are your best allies in protecting your health. Stay proactive and listen to your body's signals. If sitting becomes uncomfortable or painful, let your doctor know. By being attentive and seeking help early, you give yourself the best chance for timely diagnosis and successful treatment, allowing you to continue enjoying life with confidence and peace of mind. Your health matters and there's always support and care available. You're never alone on this journey. It's important to pay close attention to any difficulties you might have when urinating, as these changes can be early signs of prostate problems, including the possibility of prostate cancer. You might notice trouble starting to urinate, a weak or intermittent urine stream, or the feeling that your bladder isn't emptying completely. These symptoms often occur because the prostate sits just below the bladder and surrounds the urethra, the tube that carries urine out of your body. If a tumor or even a non-cancerous enlargement presses on the urethra, it can make it hard for urine to flow freely, leading to retention of urine in the bladder. This can cause discomfort, pain, and sometimes result in urinary tract infections, especially if your bladder isn't emptying all the way. If you're experiencing any of these urinary problems, it's vital not to brush them off as merely an unavoidable part of aging. Instead, consider them as your body's way of alerting you to a health concern that needs to be addressed. Getting in touch with a healthcare professional ensures you receive a thorough evaluation and, if needed, timely treatment. Early detection is key, and many prostate issues, including cancer, are much more treatable when diagnosed sooner rather than later. Remember, looking after your health by noticing and reporting even small changes can make a big difference in your quality of life. Your well-being matters, and taking action now could help prevent more serious problems down the line. Don't hesitate. If you notice trouble urinating, seeking help is a positive, proactive step towards a healthier future. Losing control over your bladder, a condition known as urinary incontinence, is something that many men may experience during or after facing prostate cancer. This happens when the prostate gland is affected by a tumor or as a side effect of treatments like radiation or surgery, both of which can impact the way your bladder functions. It's important to understand that this issue is fairly common, especially among men who have undergone prostate cancer treatments. Studies show that up to a quarter of men might notice this change. Urinary incontinence can range from occasional leakage to a sudden, urgent need to urinate that sometimes can't be controlled. For many, this can be more than just a physical inconvenience. It can affect self-confidence, disrupt daily routines, and make social situations challenging. If you notice that you are leaking urine more often or can't hold your urine in as well as you used to, please don't brush it off or be embarrassed. There are effective ways to manage and treat urinary incontinence, and the first step is to reach out to your healthcare provider. They can help determine if your symptoms are linked to prostate cancer itself, to treatment, or perhaps even to another health issue entirely. Most importantly, remember that you are not alone. Many men have faced and overcome similar challenges, and with the right support and care, you can maintain a high quality of life. Take courage in knowing help is available, and by addressing these symptoms early, you take a powerful step toward protecting your health and well-being. Pain during ejaculation, whether it's a mild discomfort or a sharp, intense ache in areas like the pelvic region, penis, testicles, or rectum, can be a critical warning sign of prostate cancer. It's understandable to feel hesitant or embarrassed about discussing intimate symptoms, but it's important to remember that your health and well-being come first, especially as you get older. Experiencing any kind of continued pain during ejaculation isn't just something you have to put up with or dismiss as a normal part of aging. Instead, It's your body's way of signaling that something might be wrong and that you should seek professional help. Catching problems like this early on can make a significant difference, not just in finding answers and relief, but also in preventing more serious complications down the road. A specialist, such as a urologist, can carefully evaluate your symptoms, determine the cause, and recommend the right treatment if needed. Sometimes these symptoms might relate to other, less serious conditions, but because prostate cancer is so much more treatable when caught early, it's always safest to get checked out promptly. By paying attention to your body and addressing persistent or unusual symptoms as soon as they arise, you are taking a proactive step in caring for your health and maintaining your quality of life. Remember, there's no shame in seeking help, and your decision to act quickly could help you stay active, independent, and enjoying life for years to come. Be your own advocate. If something doesn't feel right, trust your instincts and don't delay seeking out expert advice. Prostate cancer is one of the most common and serious health threats men face, but the good news is that early detection can make all the difference. Recognizing warning signs such as pain or burning during urination, frequent nighttime trips to the bathroom, unexplained pain, or changes in urinary or sexual health could potentially save your life. Don't ignore these symptoms or hope they'll go away. Take charge of your health, talk to your doctor about any concerns, prioritize regular screenings, and make healthy lifestyle choices. Stay informed, stay proactive, and encourage others to do the same. Your vigilance matters.